News reporting. Beware, danger at the doctor. Here's Bill Hemmer.
When we visit the hospital, we hope to be cured, not get sicker or possibly worse. As a society, we're well aware of the big threats to our health, heart disease, cancer, and so on. But what if one of the biggest threats is the world of medicine itself? This hour, we're looking at medical errors. How much danger are we in? How are they being managed, and what can we personally do to prevent them? And a warning, some of the things you will see in this report may disturb you. We begin now.
A young professor, my wife at that time she was 33 years old, and she suddenly got pain in her right foot.
Dr. Frederick Southwick had been a star athlete on both the football field and wrestling mat at Yale University in the 1960s. Now a professor of medicine at the University of Florida. He knows full well the repercussions of medical errors after his first wife, Mary, sought help for her foot pain.
She initially sought care from a neurologist, followed by an internist, and they didn't come up with the proper diagnosis. She developed phlebitis, which is clots in her leg, and was admitted to the hospital and got insufficient blood thinner.
That sent her into a downward spiral, an embolism, a heart attack, kidney failure, and a 10% chance of survival.
Miraculously, the cardiologist who finally took care of her decided to give her corticosteroids. And once the steroids started, all the symptoms and signs reversed, and she actually walked out of the hospital. It was really a miracle that she survived.
As a result of his wife's brush with death, Fred Southwick's career changed direction.
I was chief of infectious disease for a long time. I decided that I needed to change my career. So I actually took a fellowship at Harvard Business School, and I studied errors through the business world, because businesses deal with quality. The problem with healthcare has been it didn't matter what the quality, you still got paid. So I did that studies, and I wrote the book, Critically Ill. From there, I helped develop projects in quality and safety in our hospital system. And I also created an online course. I've tried to disseminate the knowledge that we all need to have in order to improve healthcare.
During a game of tennis in 1995, Southwick tore his Achilles tendon.
I had an operative repair, and that repair seemed to go okay. However, I did notice that my foot afterwards turned blue when I went in the water and felt a little funny, but I was told it was just a little bit of nerve damage from the surgery. I didn't think anything of it.
July 2012, 17 years after his tennis injury, Southwick was out paddleboarding.
I got what I thought was a severe calf pill, but over the month it did not get better, and my foot turned white, and immediately sought medical attention. I'd lost all of the circulation below my knee, and yet the circulation every other part of my body was normal, and the vascular surgeons were dumbfounded. Well, after the dust settled, the only choice was to do an above-the-knee amputation. And as I was recovering, I said, what happened to my left leg that didn't happen to my right? The only thing was that Achilles tendon surgery. When I went back to the OR report, I found that they had placed a tourniquet above my knee for over 2.5 hours. And that tourniquet had damaged the arteries below my knee, and I had been living off 1 instead of 3 vessels for all those years, and that final vessel then clotted off, and that explained the loss of my leg. So it was actually a surgical error that caused the loss of my leg.
Through all of this, he gained a unique understanding of the true nature of medical errors.
No one intended to hurt me. What it's really done for me is motivated me further. The other thing it's done is because I still care for patients, I show patients what happened to me, and they really bond with me. So in one way, it's been a terrible loss. In another way, I've had some gains in my ability to interact with patients and to counsel patients. And also, I think it gives me more credibility in the patient safety world, because I have been on both sides of the fence.
Medical errors can be a devastating problem. There are people who are trying to make things better.
There are more places for errors because There are more medications being given than ever in the history of medicine.
Part of the solution is to have patients themselves take charge of their treatment.
We're going to do a procedure, and I'll explain it to you what it is.
Dr. Manny Alvarez, chairman of obstetrics and gynecology at Hackensack University Medical Center, has a checklist for being your own advocate.
Number one, bring somebody with you to listen, to ask questions, to write things down. If they're giving you medication, ask questions. What is that medication? If they're taking out your blood, you could ask, why is my blood being taken? Make sure the staff follows all hygienic protocols. Can hand washing in a hospital make a difference in transmitting bugs? The answer is 100% yes. Is hand washing something that is routinely done by healthcare professionals in a hospital? No. Only 30% of people wash their hands. If you think that you need a second opinion, seek one out.
Good. You okay?
Make sure that you participate in every activity when it comes to patient identification or making sure that if you're having surgery, the surgeon has the proper knowledge.
The patient's name is Jane Smith, S-M-I-T-H.
And consent for the type of operation that you're going to have.
Everybody in agreement? Agree.
When in doubt, call it out.
Meanwhile, there are many healthcare professionals dealing with the matter of medical errors.
Help! Code blue! Code blue!
We traveled to Scottsdale, Arizona to the 18th Annual National Patient Safety Foundation Congress.
We have gotten better, but it's been too slow. And everyone wants these changes to come faster.
Dr. Southwick, whom we met earlier, was one of the many attendees.
So what we do is share our experiences, our best practices, and our expertise with each other so that we can all become smarter and we can all apply what is working in other areas of the country.
We're teaching patient safety in medical schools and nursing schools and other forums to make sure people understand what are the causes of error, how do you design systems to try to prevent error, etc.
Dr. Tejal Gandhi is an associate professor of medicine at Harvard Medical School.
We still have a long way to go, but we have made progress.
Teaching patient safety is one thing, but Dr. Gandhi feels in order to create safer hospitals, the medical culture must also change.
We're working on creating a culture of safety where everybody is comfortable speaking up and know that they won't be blamed or punished for speaking up, but actually will be listened to.
You know, you want your nurse to speak up when they see something that doesn't look right. And it's our job as surgeons to empower them to say, look, if you see something that doesn't look right, say something. I'm capable of making mistakes.
One life lost to preventable medical error is too many. And because preventable medical errors are just that, they're preventable, means logically they should have never have happened.
We don't want to create fear. We don't want to create hysteria. We want people to recognize that it's a great profession with doctors trying to do the right thing, but it's a messy system. And unless you take charge of your own care, it could be a very scary proposition.
Hospitals are among the most trusted institutions in our country, but healthcare is as much art as it is science, and mistakes, as you have just seen, do happen. But there is good news. The healthcare industry has recognized that medical errors are a problem, and it's trying to find ways to reduce them as much as humanly possible. That's our program. I'm Bill Hemmer. Thanks for watching.